When should you get a colonoscopy for diverticular disease? Imagine having a condition that affects your colon, causing small pouches called diverticula to form. Sometimes these can cause discomfort or complications, and knowing when to get a colonoscopy can be crucial. Let's explore the facts. If you've had an episode of complicated diverticulitis, which means there was an abscess, perforation, fistula, or obstruction, doctors usually recommend a colonoscopy about 6 weeks after the acute episode. This waiting period allows inflammation to settle down, making the procedure safer and more accurate. The goal is to check for other serious issues like colorectal cancer or inflammatory bowel disease, which can sometimes mimic or coexist with diverticulitis. Studies show that in cases of complicated diverticulitis, the risk of underlying colorectal cancer can be around 8 to 11%, so screening is important. For uncomplicated diverticulitis, the need for a colonoscopy is less urgent. If you've had a recent high-quality colonoscopy within the past 1 or 2 years with normal results, your doctor might not recommend another right away. In these cases, the risk of cancer is similar to that of the general population. However, if symptoms persist, recur often, or if there are warning signs like unexplained weight loss, rectal bleeding, or changes in stool shape or size, a colonoscopy might be advised. Age and other risk factors also matter. People over 70 or those who had complicated diverticulitis are at higher risk for colorectal cancer and should consider getting a colonoscopy after an episode. Timing is key. Most guidelines suggest scheduling the colonoscopy between 4 and 6 weeks after the inflammation has resolved. Waiting too long might delay the detection of cancer, but rushing into the procedure too early could be unsafe due to ongoing inflammation. If you've had a colonoscopy within the last 1 or 2 years and your results were normal, repeating the procedure immediately after uncomplicated diverticulitis may not be necessary. It's also important to remember that colonoscopy is an invasive procedure with some risks, like perforation or bleeding, especially in inflamed or fragile colon tissue. That's why a selective approach is recommended. Patients with uncomplicated diverticulitis and recent normal colonoscopy can often be monitored with regular checkups and non-invasive tests. Those with complicated disease or persistent symptoms should be prioritized for colonoscopy. In summary, if you've experienced complicated diverticulitis, a colonoscopy about 6 weeks after the episode is usually advised to rule out cancer or other serious conditions. For uncomplicated cases, if you have no recent normal colonoscopy and symptoms continue or worsen, or if you are older or have other risk factors, a colonoscopy should be considered. Always discuss your individual situation with your healthcare provider, as they can give personalized advice based on your health history. Remember, timely screening and follow-up are key to managing diverticular disease safely and effectively.